Food signs in radiology. Celery stalk metaphyses. This is a term referred to vertical striations in the metaphysic of long bones or pelvis produced by the dysplastic bone disease like osteopathia striata. This is an asymptomatic condition and the radiological picture resembles with the celery stalk, a vegetable used in salad. Similar picture may also be seen in congenital rubella infection. Rice grain calcification. Calcified cysticerci within the muscles produce ovoid flecks of calcification parallel to the long axis of muscles, resembling grains of rice. Apple core lesion. The annular carcinoma of colon produces focal circumferential thickening of the bowel wall, narrowing of colonic lumen, associated with shouldering. On barium examination, this gives rise an appearance of the affected colon similar to the partially eaten apple called apple core lesion. Coffee bean sign. This term is referred as the enormously dilated air-filled sigmoid colon in sigmoid volvulus resembling a coffee bean on plain abdominal X-ray. The dilated sigmoid colon arising from the pelvis may extend up to the diaphragm and the opposed medial walls of colon give appearance of the cleft of coffee bean. Omental cake. The metastatic infiltrations into the mesenteric fat from the adenocarcinomas arising from carcinoma stomach, colon and ovary produce soft tissue lesion in the omental fat called omental caking on CT scan. Anteriorly, this soft tissue density in omental fat gives the appearance of cream over the cake, called omental caking. Lollipop sign. The lollipop sign is seen in hepatic epithelioid hemangioendothelioma. It represents hepatic or portal vein and/or their tributaries branches tapering and terminating at or just within the edge of a well-defined peripherally enhancing lesion with an avascular core on CT or MRI. The target-like magnetic resonance imaging appearance of tumors may be due to a central zone of fibrosis and a rim of cellular proliferation, with central signal hypointensity corresponding to hemorrhage, necrosis, or both, and peripheral hyperintensity corresponding to tumor cellularity and adjacent edema. Pear-shaped bladder. This term is referred to as the appearance of the urinary bladder on cystogram examination resembling with the pears. The causes for the pear-shaped bladder include pelvic lipomatosis, pelvic hematoma, pelvic collection, pelvic masses, bilateral pelvic muscle hypertrophy or lymphadenopathy. Berry aneurysm. The appearance of the intracranial saccular aneurysm on CT scan may resemble the size and shape of a berry, hence termed berry aneurysm. It may occur in isolation or in association with polycystic kidneys or coarctation of aorta. Banana sign. The banana appearance of the cerebellum on the antenatal ultrasound due to downward traction of the spinal cord and brainstem in neural tube defects gives the name banana sign. Lemon sign. The appearance of the fetal cranial vault on antenatal ultrasound resembling lemon is an excellent indicator for the open spina bifida. Hot cross bun sign. The hot cross bun sign. MRI appearance of the pons when T2 hyperintensity forms across on axial images, representing selective degeneration of transverse pontocerebellar tracts and median pontine raphe nuclei. Common causes. Multiple system atrophy, cerebellar type. Spinocerebellar ataxia. Polo mint sign. It is seen in the venous thrombosis. The polo mint sign is a description given to a venous thrombosis on contrast-enhanced CT imaging. When viewed in the axial plane, a thin rim of contrast persists around a central filling defect due to thrombus. This gives an appearance like that of the popular UK mint sweet. It was originally described to refer to the appearances of a pulmonary embolus on CT pulmonary angiography, but the appearances are the same for any venous thrombosis, such as in the portal vein.